same procedure, except that now we're going to do a non-thermal ultrasound. Let's say she's got an acute inflammation. So for an acute inflammation, what would be my parameters? Non-thermal ultrasound. Let's say I'm doing, let's do our CMC joint.
3 megahertz. 20%.
Okay, 3.3 megahertz because it's
Yeah, it's
pretty shallow, pretty superficial, right? Because if you're at the CMC joint, it's all about what do you think is going to get down to here, okay? So 3.3, 20% because it's non-thermal, okay? How long should I treat it for? How big of an area do you think? Which size head should I use? Should I use this one? Should I use this one? The smaller one, okay? For the purposes of the demo, because I've filmed this before, I'm using this one because you can't see the water move as well with the small one, okay? And then how big of an area? How long should I do this for? 2, 4, 6, 8, how long? Maybe 4 minutes. From an insurance billing, it would be 8. Okay, so I would set it for 4 minutes. I would set my intensity for between 0.5 to 1.0. I can always go up. It's always harder to go down than it is to go up. Okay. I would set my parameters to 3.3. I'm at continuous, so I'm going to switch it to 20%, and my ultrasound head is attached. Okay. I'm going to have her wash her hands before she puts it in the water. Okay, dry it completely, make sure there's no soap on there. Then she would put her hand into the water.
Wash first.
Okay, and I want her in a comfortable position because your arm's going to be like this for a while. So get your hand in a really good, comfortable position.
Is this fine down?
Any way you want. Okay. Now scoot a little bit closer so your hand's not so. Okay. And now what you're going to do is this is going to be submerged. This goes in the water. Okay? So this is going to go in. The whole part is going to go in her. I'm going to purposely keep it here to the side. And I'm going to hit start. And now look. Look at the water. Can you see the waves? If I bring it up, can you see the waves even more? Okay. So those are the waves. So even though you can't physically see it, you can see the water moving. Now what I'm going to do is I'm going to go about a ½ inch away from the area, and I'm going to keep the water, I'm going to keep the ultrasound head submerged, and I'm going to go around the area with the ultrasound head. Can you see how I'm doing that? Okay. Notice I'm not using a metal bucket. No, you want to use a plastic bin. Because don't use metal, because the metal will reflect it.
So in the water, you're not touching the skin?
Not touching the skin. The water's your medium. Okay. If I'm here, I'm too far away. I want to be about a ½ inch to an inch away from the surface. Now, because of the bucket that I have, I don't have a great angle because it's not deep enough. So sometimes then I have to say, okay, I'm going to move the ultrasound head away. Can you turn your hand over now? All the way over. Flip it over like that. And then I can get the other side. See how I can do that safely? So then I can go in and get the other side. But the transducer, you notice, is always in the water. Okay? And in the water, again, I'm moving it. I try to do I do more of a linear movement like this, back and forth, instead of the circles, because I've got less space to move. That's just my personal preference. You can do this motion, you can do this motion. But when you see it on the top too, can you see how that goes? Can you feel any of this? And what does it feel like?
Front, I can feel it.
Okay, flip your hand over again and tell everyone what it feels like.
Well, this is the side I can't feel. So,
Well, put it back to the side you can't feel.
This side I can't feel. It almost feels like a fan, like the air blowing on a fan.
Blowing water at it, yeah. Okay, and that's how you would do it. The thing that will get you in trouble is if you were doing it like this. Because if I'm in the air is reflecting it. and it's not getting in. So you've got to make sure that your whole transducer head is in. Okay? Works great for feet, works great for hands. If you had a bigger bin that was plastic or bucket, you could actually do ankle and elbow sometimes too. But usually you'll see it for digits. So that's this one.